Hi Bio30, welcome to 15.3. Our topic is reproductive technologies and contraceptive technologies. The difference between infertility and sterility is that if there's a sterilization, there will be no longer any ability to conceive a baby, whereas infertility is something that something that reproductive treatments and fertility treatments try to help out. Causes of that could be things like blocked tubes in males or females due to previous STIs, for example. Could be chemical exposures to things like alcohol, smoking, or medications. And also, of course, some hormonal imbalances, lots of reasons why infertility could result. Looking at the technologies for assisting reproduction, AI is artificial insemination, where sperm are maybe collected and concentrated before artificially introduced into the uterus, where they will continue on to fertilize an egg. So this would be done when they know ovulation is about to happen. With surrogacy, this is when a couple can't conceive and they have a fertilized egg that is given to another woman to carry. I believe that this is something that in some places in the world, including the US, you can hire some woman for. In Canada, I believe it's not something you can hire someone for, but someone can be as a surrogate for a couple of links you can check out. Superovulation is where someone is going to get eggs fertilized, so they will take medication to make multiple eggs produced that month. So it could be like anywhere between 8 and 12 or so. And so multiple eggs will be released from the ovary. So then when they are retrieved with a syringe that actually goes through the belly right into the ovary to retrieve those mature eggs, they then have a lot of eggs that they can do in vitro fertilization with at one time. IVF is probably the most important fertility treatment that you should know about, and in vitro means in glass. So there's like basically a petri dish where eggs and sperm are put together. This is for many reasons. Some women are preparing this for a surrogate. Some women are unable to get pregnant, and so they want to join the egg with concentrated sperm. And sometimes they're using frozen embryos from this procedure, and they can give those back to the woman years later. And so these in vitro fertilization embryos are one of the major kind of technologies that infertile couples end up doing. If other procedures don't work along the way, they will end up with IVF, and they can freeze implant one or two embryos and freeze the others for later. Fertility procedures as women get older tend to decline, and so the earlier they start these procedures, the more likely they will end up with a pregnancy. But we're still looking at in the range of half of the women who go for in vitro will end up with pregnant from it. So there is better technologies all the time, but it's still got its challenges. Gamete intrafallopian transfer is when the sperm and egg are joining in the oviduct, and so that's normally where fertilization happens. So they say success rate is a bit higher for that. ICSI, which is intracytoplasmic sperm injection, is when a sperm, just one, is chosen to be basically inserted into an egg. So the sperm would be sent into this egg cell, and of course you want to pick a perfect sperm for this. And so that's the bit of controversy over that, because if there ends up being some problem with that fetus, they had to be very sure they picked a very perfect sperm. Usually the best sperm are the ones that can swim all the way to the egg. In this case, they will do this if there is some problem with like low sperm count, where remember we need like 500 acrosomes of sperm to even get into the barrier of the egg. If there's a low sperm count, then this is something where they can take just the one, and once it's inserted, the tail will fall off, and those hopefully the nucleus of the sperm and the nucleus of the egg will join together and form a zygote. You can watch this little ICSI video. Eggs can be screened. You guys can check out the advancedfertility.com site to see what some really great eggs look like, some not so great eggs. And so they do pick eggs when they go through in vitro fertilization that are really good looking eggs that they want to fertilize. And then they'll watch as they develop in like a uniform morula before they would choose that embryo to put back into the mom to carry to term. Removal of sperm can be done with TSE, testicular sperm extraction, and assisted hatching is where before they implant this fertilized egg, looks like this is a morula stage, ball of cells. Assisted hatching is where they puncture or kind of rough up one edge so that it will more likely attach to the endometrium on that spot. So that's what assisted hatching is. And embryo transfer is when the blastula stage is the one that's implanted or implanted into the uterus. Okay, you can check out this ethical issues, of course, that for all fertility procedures and technologies, or any technologies, come with the pros and the cons. The last part of our chapter 15 is looking at contraceptive technologies, and conception is when there is a pregnancy, and contraception is technologies, either physical barriers or hormonal barriers to pregnancy. So abstinence is basically no relations at all. That would be a way not to get pregnant. Sterilization, you guys should definitely know about females getting their oviduct cut or fallopian tube, and so of course the egg then cannot get sperm to it, and it can't get down to implant in the uterus. And in males, that is a vasectomy where the vas deferens is cut, and then of course sperm cannot get any further. So sperm can still be produced, but they will just get reabsorbed because they will not be leaving the body. And incidentally, the other fluids that make up semen would still be formed from the 3 glands, but just no sperm will be in the semen. A couple different methods of tubal ligation, you can look at that. Big picture of vasectomy. Hormones are also used for interfering with fertilization, and so very common is the birth control pill that has different levels of estrogen and progesterone through the month. So it basically is preventing a follicle stimulating hormone from being released, so there is never a follicle developed. So basically on the birth control pill there will not be an egg developing that month. This one, mini pill, is using that same idea but using only progesterone in case somebody has an issue with estrogen and progesterone. They can try this one. The patch is estrogen and progesterone in bigger doses that are in a patch on the skin that will last for months until another patch is used. Some of these, because of high doses though, come with a lot of side effects. The ring, you can check out the video, but basically the ring, NuvaRing, is estrogen and progesterone released from a ring that is sitting in the vagina. There's implants that can go under the skin. There's Depo-Provera injections that can last for about 6 months. Again, some of these that last a long time, like patches and Depo-Provera, have to be really monitored, have to look really carefully at what kind of side effects they're causing, because there is kind of a potential of really affecting the body negatively when those high doses are put in that last that long. So I tell females to really take a look at side effects, because if they are starting to get multiple side effects, it is likely that that method of contraception is not the best for your body, and you may have to start looking at a different kind, because the implications and the effects can get more and more serious. If you have some, you're likely to keep getting more. The pill does have some links to a lot of these things, clots and, linked to cancers and different things, migraines, headaches. Patch, same kind of thing. One thing to keep in mind is that that your body will get depleted of vitamins and minerals. So on these birth control methods, that's important to be careful of, is keeping up with your vitamins and minerals. And if you are realizing a lot of side effects are happening, maybe time to really look at something as an alternative. Here's a list of some vitamins that can be depleted and something to keep in mind. I threw this one in there, side effects of Depo-Provera. We've got a lot on the list for these other ones, but for Depo-Provera, there is a lot. So this was the 6-month injection. Take a look at these, because some of them can get very serious, like hair growth and fainting and allergies you never had before, and clots and breast milk and all these other kinds of things, swelling and weight gain and all these things. So something to keep in mind if this is a new medication that someone is on. Keep a lookout whether these things are happening, because they are not positive side effects to the body. Physical barriers, like condoms, it says are around 85% effective, which is why they are usually used along with something like a spermicide. Diaphragm fits over the cervix. Sponge is something that is also preventing sperm to getting into the uterus through the cervix. Cervical cap. You guys can take a look at any of these as images or videos and see more about them. Spermicides, again, 75% effective, often used alongside the condom. We've talked about a whole bunch of different devices. The last one here is the IUD, which is an intrauterine device that goes into the uterus, and some of them have hormones, some of them are just in there that and causing sort of an unfriendly atmosphere for environment for implantation of a fertilized egg. So this means a fertilized egg could come down, could end up in the uterus, but not implant, because the wires, the copper in there, or potentially the hormones, if it's a hormone one, are actually causing the endometrium to be thinner, and just the interference of that in there is not allowing implantation. So usually every 5 years someone would get this replaced, and it's pretty tiny. It looks like this. Doctor would put it in, doctor would take it out. You should know where the IUD would sit in the uterus. Birth control affecting its extra hormones that would cause a negative feedback to the ovary, making no FSH to make follicle development. Something like the condom is preventing sperm from coming into the cervix, so that's a good poster kind of reviewing those things. And then coitus interruptus, withdrawal, taking your chance with that one. And basal body temperature does drop just before ovulation, so people who are really looking at exactly when ovulation happens can look for that dip in using a body temperature thermometer that's very, very precise for that. So that's an interesting thing. Natural family planning rhythm method is looking at which days are more likely to be the ovulation days and basically avoiding sex during those days. So again, this calendar method, because cycles of a female are not always that regular, this one is about 70% effective. Last bit here on pregnancy termination. High doses of hormones can cause cramping and potentially, prevent the implantation of a zygote. There's the abortion pill that basically removes the endometrium up to 7 weeks and kind of induces a miscarriage. And then dilation sometimes would be the method that DNC that is used like as an abortion method, or even if like a placenta isn't completely coming out, they might DNC and remove it that way. Couple funny methods that don't work. You guys can read about those, and lots of good videos again. So we were going to watch In the Womb multiples. So if you have a chance to hang out for an hour and a half and see that, it is excellent. We were going to take a class day to watch that, guys. So you could take a look at that. I also will have a few links on Google Classroom that you can check out. But that is all for Chapter 15. Thanks for joining me, and we shall talk to you later. Bye-bye.